Assalamu alaikum and good afternoon. So my topic is on cardiac rehabilitation. I think this is the most neglected part of our cardiovascular services. So now, definition of cardiac rehabilitation is the comprehensive program designed to improve the physical, psychological, and social well-being of the patients with heart disease. It involves a combination of exercise, education, and counseling aimed at preventing and managing cardiovascular disease and reducing the risks of future cardiac events. So what is the importance of this cardiac rehabilitation? It is an essential component of the management of the heart disease as it helps improve heart health and overall quality of life. It has been shown to reduce hospitalization, lower healthcare costs, and improve patients' outcome, such as reducing the risks of future cardiac events and mortality. So what are the goals of cardiac rehabilitation? There are primary goals and there are some secondary goals. The primary goal is to help patients recover from a cardiac event and improve the overall heart health. Secondary goals are reducing risk factors such as high blood pressure, high cholesterol, and diabetes, improving physical fitness and functional capacity, and to enhance the psychological well-being and quality of life, and to improve the education and support for lifestyle changes such as diet and exercise. So what are the benefits of this cardiac rehabilitation? Is that to improve the cardiovascular fitness, to improve the quality of life, it reduces the mortality and also the hospital readmission. And it also improves adherence to medication and lifestyle changes, and also the improving psychological well-being and reducing the healthcare costs. There are three phases of cardiac rehabilitation. The phase one is inpatient rehabilitation, and it begins during the hospital stay after a cardiac event and focuses on early mobilization, education, and risk factor management. And in phase two is the outpatient rehabilitation, and this starts after the discharge from the hospital. And it involves exercise, education, and counseling over several weeks to several months. And this phase three is the maintenance phase, and it involves indefinitely and includes ongoing exercise and lifestyle changes to maintain the heart health. So this is the patient selection criteria for the cardiac rehabilitation. This is the patients with a history of heart attack, patients who have undergone CABG, patients with stable angina, and patients who have undergone angioplasty or stenting. Patients with heart failure with reduced ejection fraction after the heart transplantation, patients with peripheral vascular disease, and as well as patients with valvular heart disease. So some patients with heart disease should be excluded from this cardiac rehabilitation, such as unstable angina or recent heart attack, severe heart failure, uncontrolled arrhythmias, severe pulmonary hypertension, severe aortic stenosis, acute infectious disease, severe musculoskeletal limitations, and cognitive impairment. There are some components of cardiac rehabilitation. These are medical evaluation assessment, then physical activity and exercise training, nutrition, counseling and education, psychosocial support and counseling, cardiac risk factor management, medication management, and as well as tobacco cessation counseling. Regarding the medical evaluation assessment, we have to consider initial evaluation and assessment, cardiac imaging and testing, some laboratory testing, risk factor assessment. There we have to review the medical history, and also you have to review the medications also. The first step in cardiac rehabilitation is a medical evaluation and assessment, and it includes a review of the patient's medical history, medication history, and risk factors for cardiovascular disease. Some cardiac imaging and laboratory testing may also be performed to assess the patient's current cardiovascular health. And based on this assessment, a personalized cardiac rehabilitation plan is developed to address the patient's specific needs and goals. Physical activity and exercise training includes exercise prescription. There are some types of exercise. Benefits of, we will discuss benefits of exercise. There is some safety consideration, and we have to also monitor the progress. Regarding exercise prescription is tailored to the individual's needs and goals. Factors such as age, fitness level, and medical history should be taken into account. The prescription will include the type, duration, frequency, and intensity of exercise. There are several types of exercise like aerobic exercise, and it improves the cardiovascular fitness and endurance like walking, cycling, and swimming. There is some resistance training like weightlifting, bodyweight exercises, and it builds muscle strength and can improve metabolism and weight management. There are some flexibility exercise like stretching and yoga, and it improves joint range of motion and may reduce the risk of injury. And there are some balance and stability training, especially for the elderly patients, can reduce the risk of falls and improves overall functional ability. Here are some benefits of exercise like it can improve cardiovascular health and reduce the risk of heart disease. It can help control of blood pressure, cholesterol, and blood sugar levels. And this also can improve mood, reduces stress, and increase energy levels. When considering safety consideration, it is important to start slowly and gradually increase the intensity and duration of exercise. Patients should be encouraged to listen to their bodies and rest where necessary. Exercise should be done in a safe environment, and appropriate equipment and clothing should be used. Now that nutritional counseling and education, it includes dietary assessment, nutritional education, healthy eating habits, meal planning, and managing weight. Dietary assessment is an important tool for evaluating a patient's nutritional status and identifying areas of improvement. Different methods of dietary assessment include 24-hour dietary recall, food frequency questionnaire, and food diary. It is important to assess a patient's nutrition intake, dietary patterns, and eating behaviors. Nutrition education is a key component of cardiac rehabilitation as it can help patients make healthy choices and improve their overall health. Nutrition education can cover topics such as portion control, reading food labels, and making healthy substitutions. And patients can also be educated on the role of different nutrients such as fiber, healthy fats, and vitamins and minerals. Regarding healthy eating habits, meal planning, and managing weight, encouraging healthy eating habits such as eating a variety of fruits and vegetables, whole grains, and lean proteins can help patients meet their nutritional needs. Meal planning can also help patients make healthier choices and avoid processed and high-fat food. Managing weight can be an important goal for many cardiac patients, and nutritional counseling can provide guidance on healthy weight loss strategies. Psychosocial support and counseling, stress management technique, depression and anxiety management, social support and networking, coping strategies, and behavioral change support. Managing stress and anxiety through relaxation techniques such as deep breathing exercise, meditation, and mindfulness practice. Identifying and managing depression, anxiety symptoms with the help of mental health professionals. Building social support and networking to manage emotional health. Developing coping strategies to manage negative emotions and stressor. And encouraging behavioral changes to support emotional well-being. And regarding cardiac risk factor management, we have to manage blood pressure, cholesterol, diabetes, weight, and smoking cessation. Regarding cardiac medication management, list of the main categories of cardiac medications such as beta blockers, ACE inhibitors, antiarrhythmic drugs, and antiplatelet agents. There should be provided a brief description of mechanism of action of each medication class, explain how this medication help to manage different aspects of heart disease such as blood pressure, heart rate, and arrhythmia. We have to counseling for adherence and potential side effects of the drugs, and we are also monitoring the effectiveness also. So, chairpersons, to conclude my lecture by saying cardiac rehabilitation is crucial for recovery from cardiovascular disease. Various components of cardiac rehabilitation can improve health outcomes. Nutritional counseling, psychosocial support, medication management, and exercise training are essential. Eligible patients should be referred to cardiac rehabilitation programs, and healthcare providers play an important role in promoting cardiac rehabilitation and improving patient outcome. Thank you for patient sharing.